Fine, sir. Yes, sir.
See, my problem was I was just negotiating for the MRI, CT, and this what you call ultrasound machine. So I took it late. We are purchasing three. See, whenever you do a treatment, is it be evidence based, right? You know why acupuncture and all did not progress up to now? आज तक acupuncture process क्यों नहीं हुआ? हाँ? क्योंकि
Lack of
evidence create नहीं
evidence
हुआ.
base.
Evidence create नहीं हुआ. Can you hear me?
Yes, sir.
Yes, sir.
It means
Yes,
I'm
sir.
putting a needle here. I do not know what anatomical changes are happening in the brain. Why we cannot do? Because we don't have a free CT scan. So I thought of purchasing a free CT scan for my patients.
सर कैमरा एडजस्ट कीजिए.
अब
ठीक है, थोड़ा ऊपर कर दीजिए, थोड़ा ऊपर कीजिए. कट रहा है, आपका चेहरा कट रहा है.
अब ठीक है.
मुझे कोई इंस्ट्रक्शन देती है तो बार बार म्यूट कर देती है.
ठीक है, ठीक है, ठीक है.
सर कल से आप फेसबुक पे लाइव वाला ही करो, ठीक है? ये बार बार म्यूट कर देते हैं कोई बिना कारण.
हाँ, कोई बात नहीं. Can you hear me?
Yes, sir.
Yes, sir, we can hear you.
Yes, sir.
Yes, sir, we can hear you.
Yes, sir. We can hear you.
What is the difference between your thinking and my thinking? I want to make acupuncture better than Shanghai University. Why? I am doing brain stimulation. Do I have evidence of recovery of the patient? Physically, patient has recovered. What has happened inside the brain on the day of stimulation? Do I have any evidence? मेरे पास कोई evidence है ऐसा? नहीं है ना? कि आज मैंने ब्रेन स्टिमुलेट किया, ब्रेन में आज ये चेंजेस आए, नर्व में ये चेंजेस आए, कोई डॉक्यूमेंट है? So I decided to purchase CT scan, MRI, EMG, NCV, and NCS studies. Why? What you are doing should be on document. One minute, please hold. Siddhar, you wait. 5-10 minutes, I'll talk to you. We'll talk. 12 minutes. You bring the price down little. You give me more best price.
Definitely, sir.
You give me the best price, I'll purchase immediately the ultrasound. Identity license, done. You give me the best price.
Sir,
जैसा ये खरीदा ना,
हाँ सर,
श्याम खरीदा कि नहीं खरीदा? कितना दिन में खरीदा?
एक ही दिन में.
कंपनी ये अल्ट्रासाउंड भी एक दिन में खरीद लेगा.
ठीक है.
बेस्ट प्राइस करो उसका.
రెండిటికి మీరే రాజేస్తారు. సార్ ఇది ముట్టుకోలేను సార్.
This don't require. I don't require.
ఇప్పుడు ముట్టుకోలేను. సరే సరే అదే రాయండి. सर लगा देते हैं हमारे को. नीडल्स किसको? सर बेस्ट प्राइस.
Sridhar, they are quoting 12.8 lakh rupees as the best price.
సార్ అన్నారు. సార్ టైం నేను చెప్పాను. సార్ నేను మీకు చెప్పాను నెగోషియబుల్ అని చెప్పాను.
You give me 1 or 2 days time.
सर अभी तो आर्डर देता हूँ. We can hear కదా. Yes, I will give you. Actually అక్కడ వాళ్ళంతా టెక్నికల్. నేను ఆలోచించుకుంటే కొద్దిగా ఆలోచిస్తే సార్ యాక్చువల్లీ శాస్త్రం కూడా అదే. మా సీనియర్ ఉంటారు. ఏదైతే ఆయన నెగోషియేట్ చేస్తారు సార్. సార్ అన్నారు ఇచ్చేయండి అంటే ఒకసారి రండి సార్.
Give me needle. ये लेगा क्या? ऊपर नहीं जाएगा, सीधा कभी बात करना. I'll finish the class in 10 minutes. Wow. Just give me 5 minutes. 5 minutes, please. Hello, can you hear me?
Okay, la.
Take your time, sir.
Give me 5 minutes. 5 minutes.
Okay, sir.
One day or 2 days, conduct చేసేస్తా.
We'll finalize it in one or 2 days. Is CM finalized? Where is ultrasound finalized? And then city also finalized.
మాకు 1 or 2 days అంతా కరెక్ట్ కొట్టేస్తాం.
But
ఓకే నేను ఇప్పుడు ఫైనాన్స్ తీసుకోలేము
well,
ఫస్ట్ టైం ఫైనాన్స్ గురించి మాట్లాడుతున్నా అది కూడా నేను చెప్పాను
what is the cost of the refurbished MRI?
3 crores sir.
Huh?
3 crores. Permanent magnet you will get out 1.5 crores. Okay, permanent magnet.
3 crores MRI.
Yeah, 3 crores.
What is
1.5 Tesla.
EMI?
EMI will come around 4 lakhs.
Sir,
सर
वो क्या कोटेशन लेते देखेंगे एसबीआई वाला आ रहे हैं ना डीजीएम वो क्या कोटेशन लेते देखेंगे अरे हॉस्पिटल डॉक्टर्स का एक पैकेज है विदाउट सिक्योरिटी 2 crores और ड्राफ्ट होता है वो भी हाँ और टर्म लोन भी ज्यादा देते నేను ఏం చేయాలో నాకు సార్ నేను ఆడిటర్ కదా ఐ నో హౌ టు ప్లే ఫైనాన్స్ ప్లే మీకన్నా నేను బాగా చేయగలను 33 ఏళ్ళు ఇదే ప్రాక్టీస్
చాలా మంది నాకు లోన్ కన్వర్షన్ వచ్చారు చేయలేకపోయారు ఎందుకంటే ఓవర్ డ్రాఫ్ట్ కట్టినా
మీ ఐడియా నా ఐడియా పని చేయండి కన్సల్టెన్సీ నేను మీకు ఇస్తాను ఎంత ఇయ్యాలి నా కన్సల్టెన్సీ మీకు పే చేయండి మీకు అది ఐడియా ఇస్తాను ఇన్కమ్ ట్యాక్స్ డిపార్ట్మెంట్ వాళ్ళు వచ్చారు మా దగ్గర తీసుకుంటుంది ఐడియా
पेन नहीं है आप चेक कर लो
मेरा 2 दिन पिछले पड़ जाने के बाद फिर से बहुत मर गया कल
మీకు గుర్తు క్యాష్ ఉందా అడుగుతున్నాను
ठीक है सर
डिस्कशन
दो दिन टाइम ले रहे हो सर
हाँ 2 दिन क्या so no you know what is the biggest problem of our medical acupuncture or anything we could not make it medical okay now we're powerful then right so what was the problem of medical science we did not had medical evidence of what we do now you are saying neuropathy do you have medical evidence that you recovered with neuropathy do the documents speak क्या कागज में ये न्यूरोपैथी रिकवर हुआ है वो डॉक्यूमेंट है आपके पास that is why we are making one of the best neuroscience center of India maybe not even in Philippines you will get that center why because we will be having 1.5 Tesla machine MRI 16 slice CT scan and 16 slice CT yes with EMG and CB with ultrasound now whatever we are doing here you can have the evidence of it यानी आप जो भी कर रहे हैं यहाँ पे जो नीडल मार रहे हैं यहाँ मार रहे हैं यहाँ मार रहे हैं यहाँ मार रहे हैं you will have the evidence कि whether the brain is recovering or not or whether it is a neurophysiological recovery or not there is a second part of the recovery which you should know first part is recovered what you have recovered that you must see every day after every 3 days 4 days we should have an MRI of the patient what degeneration was there and now what regeneration is there needle नहीं मारा मैंने सिस्टर अच्छा ठीक है थोड़ी देर में so this is what I'm creating here one of the most excellent center of neurosciences because we have Siam you can see the Siam picture OT rooms although it is now my procedure room in We'll convert it to totally an OT. Here, this will be a CT scan machine. This room will be OT room. This will be OT. This will be closed. This will be a sterile zone. This will be our dressing zone. So this is what we are planning now, to give a medical evidence to acupuncture. And that's what I said. Achha, how many physiotherapists are here? How many physiotherapists are here?
Yes, sir.
No, Indian physiotherapist कितने हैं?
Yes, sir.
हाँ?
Yes, sir.
संजय सिंह. आप कहाँ से सिंह साहब? संजय सिंह, where are you from?
Hello.
Where are you from?
I'm
हाँ? आप कहाँ से हैं? Some background noise is going on. Sanjay Singh, where are you from? Sanjay Singh, where are you from? I can't hear. Hello, can you hear me?
yes, sir.
Yes, sir.
Sanjay Singh, where are you from? You have a lot of background noise. I can't hear anything what you are speaking. You type and say.
Ssatri, sir, what is in your background sound?
I don't have any background sound. There is no sound here. My fans are also switched off.
I think the sound come from Sanjay.
Sir, myself Mohammad Irfan from Andhra Pradesh state, sir.
So I'm looking for two good physiotherapists who wants to work and who wants to learn. Who wants to learn and who wants to work. So
So I'm from Pakistan.
no, we want Indian. So whichever physiotherapist wants to apply for learning fellowship course and also learning how to recover paralysis, how to work technically. I don't want non-technical people. I want who wants to learn everyday MRI scans, who wants to improve his studies because tomorrow we have CT scan. You have to sit with the MRI radiologist and see how to understand the differences and the changes of first day, second day, third day, whether NCV test is giving good result or bad result, that part we have to see. Treatment is not the issue. What is the prognosis of the patient is the issue. यानी ट्रीटमेंट जो आप कर रहे हो वो इश्यू नहीं, ट्रीटमेंट करने के बाद जो रिजल्ट आ रहा है, जो चीज आ रहा है वो इश्यू, इसको हम प्रोग्नोसिस बोलते हैं. प्रोग्नोसिस इज हेल्दी और अनहेल्दी. हम लोगों ने क्या किया, दर्द कम हो गया, बीमारी ठीक हो गई. बीमारी तो अंदर से जमा पड़ी है. बीमारी तो कैंसर का ट्यूमर है. आपने कैंसर ट्यूमर निकाल दिया, नहीं निकाला था, तो क्या ठीक हो गया बीमार? नहीं हुआ. What you need is to work with the disease, not with the symptoms. जब तक आप सिम्टम से फाइट करेंगे, डिजीज रिकवर नहीं होगा. So, now that part you want to decide whether what you want and what you are getting. See, my thing is until you become a specialist like me, I have given more than 20 years myself before teaching, proper teaching. Why? Because I know by doing this, the patient will recover. By doing that, patient will recover. हाँ सिस्टर को बोलो वो कर देगी वो आगे चले गए कोई अर्जेंट केस आ गया कोई हार्ट का डेगरेस्ट या कुछ हुआ हॉस्पिटल में वो 9 बजे आने के नहीं मैंने बोल दिया ब्लड से निकाल के कर हाँ सलाइन से यू टेल देम दे विल डू इट टेल देम नहीं नहीं 1 घंटा में खत्म 1-1.5 घंटा 100 ml हाँ अनिश को बोल दो करो So now you can say we have started stem cells. We have started working with what? Brain stimulation. Where did we start from? A simple dry needle. And where we are going? We are going to the higher end recovery of the patient. So that the patient does not become sick, his organs become strong. यानी बीमारी को अंदर से खत्म करने की बात कर रहे हैं, खाली दर्द को खत्म करने की बात नहीं कर रहे. We are trying to make his organ healthy. How? By inserting stems. Now, outside if you go, the stem cells are what? 5 lakh to 25 lakhs. We are trying to make it in how much? Entire cycle of 10 or 15 into 50 to 60,000 rupees. 10% of the cost what we are doing outside. Now what do you want that you have to decide? A recurring disease? एक बीमारी जो बार बार आपके पास आती है, जो बार बार और ऑटो इम्यून डिजीज जो बार बार और परेशान करती है और कुछ करती है, या वो डिजीज जो बाद में रिकवर करती है. So your studies should be evidence based. What did I purchase? All the equipment, NCV, EMG, ultrasound, 2D echo. It's not a diagnostic center, it's a rehabilitation center, just according to you, a physiotherapy center. But what did I convert? To a high-end center. I purchased CM. Why? I want to prove you that by putting acupuncture needles, you don't damage the nerve roots. यानी acupuncture needles लगाकर आप किसी भी तरह का नुकसान नहीं पहुंचा रहे. Here a needle, here a live needle. You can see live. We have the videos also of yesterday. We'll put it in the Facebook. कि आप needle कहाँ तक जा रहा है, कितना roots तक जा रहा है, कितना जल्दी recover कर रहा है. That part. Pain is not a disease. First thing in life is to reduce the pain ताकि patient comfortable हो सके. फिर उसकी बीमारी के साथ fight करो. If the patient is in severe pain, and then you treat him, what is the use of your treatment? 4 दिन में भाग जाएगा. He'll run away in 4 days. First thing is to reduce the pain so that he can live comfortably. Then you have enough time to treat the disease. This is the process. And that is what I said. Those who are interested to learn, those who are really interested to work, they should have a vision. What you want to be.
We want.
What do you want? Mr. Singh, what do you want? Yes, Lord, your sound system is wrong. You have to correct it before talking to me. I can't hear anything what you're saying. Close your mic. So you may ask me your questions. Sorry, today I was late because a lot of things are there. It is not Easy to create a system in 1 month or 2 months. I've created entire clinic in 1 month. I'm buying CT scan, ultrasound in 1 month. What is the money I bought? Only 2,000 rupees in my pocket. यानी मैं 2,000 रुपये से आया था गुवाहाटी से यहाँ, और सब यहाँ का सामान यहाँ से करते 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 इकोनोमाइज करते करते करते, and we are the cheapest center of Hyderabad, we can say. Not only cheapest of Hyderabad, but also of India. You can compare the rates of CMC Vellore and you can compare our rates. We are making EMG, NCV test all free. Outside you go 8,000 rupees. In Singapore, it is around 50, 100, $200. We are making all the investigations free in the package. Why? Because we must have evidence-based recovery. जब तक आपके अंदर एविडेंस नहीं आ जाता कि बीमारी रिकवर हो गई, तब तक आप, and you cannot depend on the market because the market prices are very high. आप एक बार करा सकते, 2 बार करा सकते, but we want every 3rd day, 4th day results. आज कौन सा नर्व वीक है? See, what is my issue? Today tibial is weak. I made it strong. Tomorrow, whether the tibial has become again weak or it is in the same position. Innervation is permanent or it's temporary. How changes are happening inside? We should have documentation. Even the Vellore did not do that. If आज अगर Vellore, Christian Medical College Hospital Vellore में ये प्रोसेस अपनाते, तो क्या ये पेशेंट ऐसे सफर करते? 11 साल, 15 साल? You give me one patient of slip disc, critical slip disc. Now how many minutes I recover the pain? 1 minute, 2 minutes. Today you will see the videos I will upload. We are making entire physiotherapy into robotics. Now you have to decide what you want. Anyway, any questions? Questions, please.
Good evening,
Any question?
Ssatri.
Yes, please tell me.
The classes for tomorrow would be strictly on the acupuncture revision or would continue with this?
No. We'll continue about, see, first of all, you have many countries, many people. There are 16 countries. 16 देश के लोग हैं. Up to now, I'm not able to understand किसका क्या level है. I'm only able to understand after you ask me questions. If I study at teaching you of DM level, higher level, what will you understand? पहले आपका स्टैंडर्ड तो पता चले, कॉमन स्टैंडर्ड क्या वो तो पता चले. यानी what is the common standard of the people by which they can understand? Why am I taking this? So that you can understand what I want to speak. I don't want to speak something what? Repeated things from the books. You have not come to learn books from me. Books are there, papers are there, you can learn. You have come to learn what M.K. Ssatri is doing.
I understand, sir. So this is to build our foundation, especially for the new students.
Not
who have
only
not-
your own foundation. We see how our students' foundation is weak because we did not see what? Every day MRI of the patient. A stroke patient has started walking. From bedridden stage to walking, we did not see his MRI. We did not compare the studies of the brain. That is our weakness. That is why these people are dominating us. Many people are dominating us. Why? Because we cannot prove it. Why people cannot dominate me? Because I prove it on the spot. A senior orthopedic surgeon came from Mumbai. Here is statement. 25 years, who done 3,000 hip and knee replacement, यानी 3,000 hip और knee replacement करने वाला आदमी वो ये बोल के गया आपका सिस्टम बहुत अच्छा है.
Exactly, sir.
Now you have to decide what you want. I always laugh at the new generation. You don't know about simple things and you are talking about a complicated matter. You are more than a neurosurgeon, I think, sometimes. Even a neurosurgeon who is married, having children, he stops everything and learns. That is why he becomes excellent. You see Lakshmanath, how much he has gone to Germany, how much he has gone to different countries to learn. A simple procedure. Even see me, to learn a simple procedure, I'm investing how much money? My entire life income I'm investing on these instruments. So that when tomorrow you come, I can show you the size of the kidney or the liver or this is hepatomegaly. Now, after putting 2 needles, the size of the liver is decreased. You can see by ultrasound. That is required. So you may ask me questions. I'll be there only for 4 or 5 minutes. Sorry, these days I'm very busy in purchasing equipments. My physiotherapists have resigned, so I have a workload of around 120 to 130 patients I have to managing and in my nursing staff. They did not resign, I relieved them because they are building one institute of diploma and they should focus on what they are doing. I don't want that they focus here also, they focus there also. Focus in one place. People never understand what is teaching. Teaching means what? आपकी गलती क्या पहले ये पहचानो. आप एक फिजियोथेरेपी कर रहे हैं, लगातार कर रहे हैं, ये कर रहे हैं, वो कर रहे हैं. अब वहां जो गलती की अब मेरे रूम में आके करो. अब दोनों को कंपेयर करो. That patience would be there. We had patience for 30 years to study. How many years? 30 years. And still we are ready to invest on MRI. 4 crore rupees MRI, 1 crore rupees CT scan. Just to count. Just to say I am correct. Just to prove NIBS is correct. You may ask me questions. And you will love to know we are creating one very good brain lab in future. Here हम लोग brain laboratory create कर रहे हैं. इसमें आप you can dissect the brain and you can study the various organs of the brain. Very beautifully you can see how the brain is functioning. Internal organs of the brain. This is what we teach in neurosciences and neurology and neurophysiology in America. But in India, we don't teach with dissections. You must be able to see the different areas and muscular anastomosis in a goat brain. Chicken beans. You must be capable to operate a goat. The other, you must be capable to remove the tumor of a goat. For me, removing a tumor of a goat or recording anything is not an easy issue. The question is, what you want? Recovery of the disease or recovery of the pain? Pain can be recovered by a painkiller also. But the disease is still there. Or अगर बीमारी और बढ़ गया, if the disease increases, what will happen? And same thing is happening in the whole country. People are dying in a pathetic death. For the first time, I found dry needles can do so many things. Now it has to be given evidences. In Assam, I had many hospitals. I could create evidence. Here, I'm working 24 hours with the patient. Now I want to create what? Full life evidence. This is the NMG of first day, third day, seventh day, and 10th day. And I'm having all these machines when? 5 days, 6 days. Orders have been placed, money has been placed. All the bank EMIs are left. Little bit formalities are left and the machines are coming. Government documentation has to be fulfilled. So think something which you really want to do in your life. Life is of 50 years, not of 1 year. This is what IP Chedian said. IP said me, I can earn more than 1 crore, 2 crore rupees. Why I came here? Because I had the best microscope of the world in brain surgery, 6.5 crores. What did I see? अब मुझे ओटी में माइक्रोस्कोप चाहिए किसके लिए? To understand the brain. यानी मुझे खुद ब्रेन को समझना है और गहराई से समझना है. तो ब्रेन को काट के समझना है, ब्रेन के टिश्यूज को समझना है, कौन सा एरिया ब्रेन का खराब हुआ है, उस एरिया को कैसे रिकवर किया जाए. Medicines cannot recover the brain. Not a single disease has recovered the brain up to now. 15 years they could not recover. What they will recover now? So that part we have to understand. साहब हो गया 5 मिनट में खत्म हो जाता है. एक्सक्यूज मी, आपको कोई बात करनी थी मुझसे? आपको कोई बात करनी थी मुझसे? भाई साहब बात करनी थी. What do you want? You have to decide. You may ask me questions. Yeah. Any questions?
Good evening, sir.
Tell me.
Good evening, sir. The process of inserting a needle and the way it is going to penetrate inside the body can be assessed through CM. Any other
Yeah, we
measures
have
can
done
also
it
be gained from
yesterday.
CM, sir?
No. So Siam life X-ray, we have done it yesterday, na?
No,
We
sir.
have
My
shown that
question
the
is,
needle has gone and
after
brain-
inserting the needle, the process of regeneration that is going to happen in the site of needle insertion cannot be gained through CM, no, sir. Whether any other materials are there
Siam, what is the
to...
role of Siam? Siam is a regenerating process or what?
No, sir. I'm just asking,
I'm
how
asking you a
can we
question.
measure
Siam is an
regeneration, sir?
X-ray machine which gives you the location. Regeneration
Yes, sir.
has to be seen by EMG and NCV test.
So it will be coupled, sir?
Yes, you have to see. But if you are working with a sciatica neuropathy, it has to be confirmed by the EMG machine whether the patient has recovered or not. After taking the painkiller, your pain is gone. That means what? Slip disc has gone. After stimulation,
No,
the pain is gone. But it may reoccur. What is the reinnervation of the nerve? That has to be proved by the machine, not by me. By the spikes of the machine.
Okay, sir.
You understood?
Yes, sir. Yes, sir.
Siam only proves the location. See, if you go and injure the epidural, you go and injure the dura, you go and injure the cord, what will happen? You are using what? 5 inches needle going inside. If you injure something else, what will happen?
Paralysis, sir.
No, it may not be a paralysis. It may create anything, like epidural hematoma. You are inserting what? Fluid inside.
Yes,
It
sir.
may
Yes,
even
sir.
create brain meningitis. So you must understand first what is the role of Siam and what is the role of EMG machine. That's what I said. You need a setup to understand and create evidence. कि really I did it. This patient came with Velo और Apollo, ये बीमारी लेके आया था, आज उसका टेस्ट करके ये देखो कि उसमें कितना रिकवरी आया। उस दिन का पैरामीटर और आज का पैरामीटर में क्या डिफरेंस है, और नहीं है तो क्यों नहीं है, उस पैरामीटर्स को कैसे ठीक करो। बीमारी अलग सी, एक बात याद रखना, कैंसर अलग है, कैंसर का पेन अलग है, उसी तरह डिजीज इज डिफरेंट and the pain of the disease is different. We are only focusing on pain, we are not focusing on disease, the time period of sufferings. How can I recover the disease so fast? Because I made it evidence based, that's all. I use Shyam to prove you that it is not injuring the cord. It is not going to epidural. It's just going there, see the location, it is safe. Now stimulate and come out and check whether the pain has gone. Yes, it is gone. Now check second day, third day. On the third day, what NCB study is saying. Then on the fourth day, see the MRI. Anything else was injured. That is why you need a good setup to prove yourself. Otherwise, practicing anywhere is so easy. I could have practiced in Karat or anywhere, but will I get these facilities? Free facilities. Patient is not going to pay. Indian patients will not pay so much money. Right?
Yes,
You have created stem cells at a very low cost. And Mr. Stem cells are working very fast. I was of the wrong impression, stem cells do not work. Now I say stem cells work very fast. On blood, on processed, on stem cells. Not from outside. खुद का शरीर का सामान अगर उसको प्रोसेस करके खुद के शरीर में डाला जाए तो बहुत अच्छा काम करता है। बस। So, any more questions?
Good evening, sir.
I request all of Indian students and physiotherapists to share my vacancy list so that I can get a good physiotherapist.
Good evening, sir. Hello. Sir, I wanted to ask you that the cancer pain, would we get relief in the first session or we need sessions?
See, you are asking me a vague question. What kind of cancer, what stage of cancer, grading of the cancer, how much pain it is, what drug he is taking?
So it is in the third grade, sir.
So you cannot decide when things can happen. You have to see the clinical history and then you have to decide.
Sir, excuse me. Good evening, sir. सर हमें एक प्रश्न था, एक पेशेंट है जिनका कि एक्सीडेंट हुआ था और ऑपरेशन हुआ था 1997 में, तो अभी उनकी फिलहाल की पोजीशन है, जब वो एक्सीडेंट हुआ था उनके पैर में, राइट पैर में जो स्किन है वो पूरी तरह जल चुकी थी, और अभी का पोजीशन ये है कि उनके वहां पर डेड स्किन डेवलप होता है और वो
देखो गलती क्या हुआ,
हाँ जी,
पेशेंट को ठीक सही समय पर ट्रीटमेंट नहीं मिलने के कारण वहां का ब्लड सर्कुलेशन खत्म हो गया, इसलिए वो पाँव वो सेप्टिसिमिया है, टॉक्सिक में ज्यादा वो पाँव कम से वास्कुलाइटिस या कुछ जेनेट हो रहा उस पाँव के अंदर,
जी
मे बी
सर,
सेप्टिक रिएक्शन।
जी सर।
तो आई थिंक दैट मेरे हिसाब से वो पाँव काटना पड़ेगा आगे जाके।
नहीं सर, पूरे पैर में नहीं है, जो
जिस एरिया में भी इन्फेक्शन है उसके पूरे पेट में जा सकता है, ये इन्फेक्शन बॉडी में फैल जाएगा इन्फेक्शन। बैक्टीरिया तो छोटा सा बैक्टीरिया होता है, कहाँ से जाता है, एक हमारे ये सिरिंज से हमको इतना सेप्टिक क्यों करना पड़ता है, इतना क्लीनिंग क्यों करना पड़ता है कि वो सारा वो एक छोटे सिरिंज से चला जाता है।
जी सर।
और फिर जो बवाल बनाता मत पूछो।
धन्यवाद सर।
Anyway, more questions? Thank you so much. Today I don't have much time to speak some other day. You have to give me some time to settle down.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Night, everyone.
Thank you, sir.
Thank you, Dee.
Thank you,
Thank
sir.
you.
Alice.
Good night, Alice. Good night, Tumika.
Hey, night, Bubia.
Good night, Mika.
Hi, night,
Good
night.
night,
Good night,
Winnie.
Mika. Good night, Winnie.
Thank you, dear all.
Good night.
Good night, all.
Good night, everyone.
Good night, everybody. Good night at Singapore. Yeah. And also in Philippines.
Bye bye. Thank you, sir. Namaste. Bye.
Namaste. Bye.
Bye-bye, kids. Namaste.
Good night.
Ah, you are cute.
Bye. Thank you. Thank you, Ssatri. God bless you.
Good night, all. Thank you.